We have, at this time, the Board of Massage Therapy.
Good morning.
Good morning. Okay. Want to make sure that Senator Hill is the only one that's out here at this time, and Senator Super and Senator Jackson. Okay.
Okay, my name's Yvonne Laird, and I'm the director of the Mississippi State Board of Massage Therapy. I appreciate the opportunity to come before you today. Denise is going to talk to you specifically about our budget. If you have any questions, the handout also provides you with some information regarding what we do with that budget. So I will turn it over to Denise.
Okay, Denise.
I just want to tell you a little bit about this board. This board is amazing. It gets so much work done and does it without a staff. So I want to just tell you a little bit about what they do. They actually license massage therapists. Those massage therapists can work in lots of different entities. They can be in a chiropractic office. They can be in a massage therapy. They can be at a casino. Lots of different places where they actually do their work. Up until last year, the board only licensed the people, and now they actually permit the facilities. And so that has increased some of the work that they do. And there's lots of reasons for that. And Yvonne, you may want to talk about why you do that, and then we'll go on into the budget.
During the legislative session last year, with the reauthorization of our act, you also included a section where we would register massage therapy businesses. Now, that's not licensure, it's just registration. That came about due to two reasons. First, because of COVID situation, the establishments where these individuals practiced had nowhere to go for direction. They would call our office, we would refer them to their, of course, CDC and the Mississippi Department of Health regarding what they could and could not do, because we had no jurisdiction over the businesses, only the LMTs, the licensees who actually worked there. So they had initiated the jurisdiction of the businesses to the board. They had made that request themselves. Also, we've had that request made at the request of law enforcement officers. We work a great deal with local law enforcement on unlicensed practice. We have quite a bit of that going on in the state, and as you probably have heard in the past, it is directly related to human trafficking and prostitution issues. It's unfortunate that our profession is one that is so closely associated with that, but due to the nature of the business, it's just a good place to hide. And so having some registration authority over the establishments, it gave local law enforcement a means to find out some information. Law enforcement has to have reasonable cause to go into an establishment. We can go in because they advertise massage. And so we will open an investigation, often at the request of law enforcement. We will also often ask them to go with us because of the volatile situation that our inspectors may be going into. So we have taken over registration of the establishments. It's not a licensure. It doesn't mean that we micromanage them. It just simply says we know who owns the business. In many instances, they are owned by out-of-state entities. New Jersey, New York, California, Duluth, Georgia. Those are the people that we have dealt with in the past that we don't have any authority to research. So often, a mama-san for lack of a better word, that actually is in the facility and performs as a housekeeper, is the one that will be arrested. We have one in the state pen right now. She wasn't the owner. She's not the owner. The owner resides in New York City. So this gives us some leverage with law enforcement that we can give them all the information that they need. We can give the Attorney General's office more information they need. Often they're not registered to do business in the state of Mississippi through the Secretary of State's office. So we want to make sure that they've done that as well. So we're just trying to ensure the legitimacy of the business and continue the profession of massage. We have approximately 2,800 licensees. We license schools, we license instructors, we license CEU providers, and we, of course, register the businesses.
Okay, you answered one of my questions. Are there any questions at this time for Mr. Dean?
Thank you, Mr. Chairman. Just a quick question. Thank you, madam, for being here. With the onslaught of the facilities that you're looking at, how many do you currently have? If it's the first year,
247.
Okay, 247.
Yes, it went into effect July 1st. We gave them till December 31st to register, and as of December 31st, we had 247.
Okay, thank you.
You're welcome.
Thank you, Mr. Chair. I have a question. Thank you. Looking at your information, you had new applications, 78 were granted. What would be a reason for not granting the 2 or 3?
Well, some are on the calendar for February.
Okay.
What happens is once the application is filed, of course, we do the criminal background check, and we're just waiting on additional information to be provided from the court of jurisdiction. I will say this, that we've only had one in the 12 years that I've been there that has been declined licensure because it was directly related to a prostitution charge, 18 counts of prostitution in the state of Hawaii. He's the only one that we did not license, you know, after we received proper information.
Okay.
In regards to your business, and I know the Attorney General's office has a particular interest in this kind of work. How often do you come into contact with the AG's office? And
On a regular basis.
okay.
On a regular basis.
And are there any other questions? No other questions?
Can I do a follow-up real quick on the Attorney General? You heard Ms. Laird talk about the fact that there was somebody in the penitentiary. That had a direct result of a hearing in a disciplinary hearing that went to a trial, and it was because the Attorney General was involved in that. And they've had several that get into civil suit.
We're currently working jointly on 7 cases.
Okay. At this time, if there are no other questions, what we would do, we would take this under advisement to review. If there's any question at a later date, we'll get back with you. Okay?
Thank you.
Oh. Thank you very much.
Thank you.
All right. Next, we have the Board of Professional Counsels. How you doing?
Doing good. How are you, sir?
Those are handouts. We have some handouts for you.
you a question?
Yes, sir.
Thank you.
I'll take it. Thank you.
I didn't. I can. Okay.
Are there, how you doing today?
Doing good. How are you?
Fine, fine. Are there any major things red flag is on thus far? Anything questionable?
They're requesting some more contractual services as well. They're requesting more contractual services for fingerprint transmission services.
Do they need to,
We're blue.
do they need time?
For the moment.
They need to hire some people. That's what they're
I
requesting.
would, it's one of the requests amounts and, it's.
Just grab what you have.
Okay.
Too serious. Just,
Okay. Okay, at this time, we have the professional counselors, and welcome to our board this morning.
Thank you, Senator Butler. My name is Richard Strebeck. I am the chair of the Mississippi State Board of Examiners for Licensed Professional Counselors. With me today, I have Ms. Leanne Mordecai, who is our executive director, and Ms. Denise DeRosset. I got it correct that time, with Cornerstone, and she and her agency manages our accounting. First of all, I would like to thank you and the legislature for our last year's budget. You approved and gave us an administrative assistant, and I cannot tell you how needed that position was. And once we have gotten that person in place for 3 or 4 months now, we didn't realize how badly we needed that individual. She has served such a vital role in the operations of our office. So thank you so much for that. Secondly, I would like to thank you for maintaining our budgeting request at the current level that you have funded us. We know some other agencies that are like function and scope and size, their budget request was reduced, and so I do appreciate you giving careful consideration to our budget request. So as we come asking for more, do not think that we are, looking a gift horse in the mouth, if you will. We would like to just take a moment to explain why we've asked for an increase over last year's budget. First of all, one of our increases is to increase the regulatory oversight and to expedite our licensing process. Our current website needs to be revamped. It's where our licensees go in to apply for a license is somewhat antiquated and very text-based and can be difficult at times to follow, very bluntly. And so if we have the opportunity to redesign that website, it would be easier for applicants and licensees to apply for a license. Secondly, it would allow us to implement and maintain, we've implemented, but we would like to continue to maintain the live scan fingerprint process. And this is a direct benefit to our licensees because it expedites the process of getting a license. As you know, in our statute, we require an FBI fingerprint background check, which can take 4 weeks, maybe up to 6 weeks. And in the past, we have had a governmental shutdown, and all fingerprints stopped at that point, which means all of our licensing stopped, and that was a few years back at the federal level. And so by us being able to do our own fingerprints in-house, that shortens the time that applicants receive their license from the time they make full application to the time we're able to issue that license. The other thing that it does is that this budget allows, we have requested an outside investigator to assist our board. Currently, our 5 board members conduct all of our investigation processes. And if I could just kind of give you a little glimpse at what that looks like. We have easy investigations that may take 3 or 4 hours, and that could be something as simple as, well, this licensee charged my credit card and I don't understand why. Well, we investigate that complaint and we realize they had authorization on file and they were missed appointments, and so we're able to kind of dig in the chart and find that pretty quickly. But that still takes 3 to 4 hours. We have what I consider kind of a moderate level, which may take 10 to 20 hours for an investigator, for a board member to investigate. And this may be something like telemental health issues that we have been so faced with recently with the COVID pandemic. And that extends into boundaries, working with individuals and crossing boundaries perhaps, as well as social media platforms. We had a hearing regarding a social media issue. And so those take a little bit more time on the board member to investigate those. And then I call them the complex, the nasty complaints that we have. Those can take 40. I have just completed one that probably has taken me 100 hours personally to investigate. And these in nature are sexual inappropriate relationships or just inappropriate relationships in general between the licensee and someone of the public. It could be alleged, exploitation of their clients in different manners. And so, as you can understand, that the serious nature of this requires the board member to slow down and take those complaints very slowly and methodical, and it takes more than a couple of hours. And I know you're thinking, well, the board members are fine doing that. Well, we are very honored to be on the board and considered an honor to serve our constituents. However, we are not compensated for those hours. We do not get a stipend for when we investigate those complaints. And so we are asking LPCs to take out of their private practice or out of their business time 3 to 5 hours up to 40 to 60 hours of their personal time to investigate that. And if we could eliminate that time by employing an outside investigator to help our board members with this complaint process, that would be of huge benefit to our board as well as our citizens, because bluntly, I'm not trained as an investigator. I'm trained as a mental health therapist. And so what an investigator may uncover or what an investigator may think methodologically as far as how to conduct that investigation may be remiss on me, because I'm just not trained in doing that. I do the best I can with what I got, but that's that. And finally, the third thing that this budget increase represents is a 3% raise for our staff. And House Bill 109, our board is excluded from that House bill, and so the 3% raise is not included for us because we are outside of the state personnel board purview. I would be glad to entertain questions or comments from the subcommittee.
Okay, at this particular time, Senator Super, you ask a question.
Thank you, and we appreciate y'all being here. I had one quick question about this money for your website. Is this just a one-time request?
Yes, it would be an initial build-out for that, and we currently pay maintenance fees on what we have now, and I don't expect that to change a whole lot as far as the ongoing expense.
Yeah, I've gotten some quotes based on the work that we want to have created to make it more user-friendly, and it's running around $15,000.
Okay.
It's right around how much?
$15,000.
Also, if I could add, we have roughly almost 2,000 licensed professional counselors in our state that we regulate, and we have about 300 provisionally LPCs that we regulate. And then on top of that, we have about 200 LPCs in process of applying and about 200 provisionally LPCs in applying. So as you can see, we're talking 2,000 to 2,500 people that our board regulates. And so as the House Bill 708 in 2018 provided the provisional statute for us, it has expanded our responsibilities as a board.
And I think something else that's important to point out is that we have roughly 50 to 60 complaints per year, and 5 board members to investigate those 50 to 60 per year. And a lot of them cannot get resolved within 1 year. So it will carry on, and hopefully we don't, have a board member to rotate off, but it's a lot of time spent by one board member because they're assigned based on district.
Okay. Are there any, okay, so.
Kind of going to another question I had. So just the board investigates. I mean, do y'all ever have to involve, like I said, the Attorney General's office or local law enforcement or anything? I don't know if they get to that level, but.
Well, the Attorney General is always involved. That is who represents the board. are assigned an attorney from that office who represents the board during hearings, and in some of the investigation, assist them along the way. I don't know that we've ever involved law enforcement or had the need to, except for years ago, before me, I've seen the files where there was some Medicare fraud, Medicaid fraud, that, of course, that involved other agencies.
Right.
And when it rises to that level, like when we go through and we're like, this doesn't add up, this doesn't look right on the billing, then we forward that to the insurance commission or that insurance company. But that, again, that's through our Attorney General Special Assistant there.
Okay, so your investigation is with the board member and usually with cooperation of the Attorney General's office?
Right. We have had to use outside investigators before, which are usually board members or former board members.
Okay, well, that's kind of where I was going
Yes,
with this. Yeah.
and it's expensive.
Right.
For them to devote their time. They usually charge an hourly rate at or above what they charge an hour for counseling sessions. So for them to spend 60 hours and then what their rate is, then it gets expensive. But when we have board members who have to recuse themselves or not enough board members, we have been down, only had 3 or 4 members, so someone from the outside had to investigate it.
Because we have to have a quorum at the administrative hearing.
And, Mr. Chairman, I have one more question.
Okay.
And I was looking here at your revenue, said it's approximately $275,000 in license. So is that from, who exactly is paying these? Like all your counselors?
Right, the license fees are for applications, for renewals, for fingerprint processing, file transfers, verifications of license sent to other states, because during this past 2 years, when a lot of the borders have opened up, licensees are trying to get licensed in other states. So that has taken a lot of time and has been an increase in funds and revenue for the board.
So how much was your revenue, this past year? Is it approximately the 275?
I think so. Denise has the exact numbers in front of her.
Does that number stay pretty level, or does it fluctuate? Okay. Okay. Thank you very much.
Okay, so, any other question? Because of our new membership, I think there should be a time when we can go over and maybe walk through their office and look at their operation. Okay. If there are no other questions, then what we would do, we would take this on that advisement and get back with you.
Okay, thank you very much.
Thank y'all so much.
Thanks for your time.
Okay, thank you.
Is this yours?
It was super.
Okay. Well, do you have my phone number? If you need to get in touch with me?
Yeah.
Okay.
Okay, thank you. Appreciate it. So let me ask you,
Sir?
so the young lady there, she covers, she works for both of them?
Yeah, she works for, she's my owner stuff.
Okay,
She does budgets for special fund agencies. She will do the budget request every year and help them with their budget request process.
okay. Okay. At this time, we have the Board of Funeral Services. I guess Cornerstone is over now. Miss Ann. Normally there's more people. Oh. I wonder what's going on. Huh? Well, the funeral service, actually, I got about 5 calls before. Okay. Good morning, Ms. Smith. How are you doing? Yeah, Sen Butler, yeah. I think we can all agree that this has been a busy year for you all. And everything.
Yeah, I have 2 more after this. I'll be here with you all day.
Okay, okay. At this time, our board will come to order, and we will allow you to introduce yourself, sir.
Okay. I'm going to take my mask off to do my introduction. Okay. I am Della Smith, the Executive Director for the Board of Funeral Services, and I thank you all for this opportunity to come before you this morning. The board currently issues establishment and individual licenses. There are 4 establishment license types and 5 individual license types. We have 466 active establishment licenses and 1,633 active individual licenses. For the fiscal year 23, the board is requesting a total amended budget request of $325,589, which I'll allow Denise to provide a breakdown of that. The board staff includes myself and 1 employee in the office, and then 3 contracted inspectors/investigators that are divided by the 3 Supreme Court districts, and they're responsible for biannual inspections, initial inspections, random inspections, and investigation of complaints received in their assigned district.
Okay.
I want to talk a little bit about the budget request.
Yes, please.
Originally, when the budget was submitted in August, we did not have the information from the State Personnel Board about their SETC2 initiative, so we didn't really know what they were going to do with the executive director salaries at that time. They went before their own board in December to talk about what the executive director salaries should be. And so we're sending an amended budget request today that actually is asking to implement what the State Personnel Board has recommended for this board. For the past probably 6 years, we have been tracking how much executive directors in small boards with less than 15 employees and don't require a licensure to hold that executive director position. We've been looking at what they've made, and almost every year, this board has had one of the lowest salaries. Their starting salary for the executive director was only $44,000. In about 5 years ago, there was a pay raise that went through, but only half of these small boards that we've tracked actually had their salary increased. So it was interesting to see what the State Personnel Board did this year. They actually said that for small agencies, executive directors at this size, tiered salary should be at $79,000. So that's a huge jump. The former executive director had been with the state for a long time, and when she took this position, she ended up making a salary about what we're asking for this position to finally be restored. So what we're asking for is for her to get the full salary that's allowable under the new State Personnel Board. The only other request that we made originally was that DFA that has an agency fee that they charge so that they can pay for the state computer systems. And they did have a small rate increase. It was only $141. So we're not as worried about that. We would really like to see what we can do for her salary.
Okay. Are there any questions at this time in reference to the budget? Can we get a motion taken under advisement? Okay, at this time, what we will do, we will take this under advisement and get back with you.
That sounds great.
Okay?
And
Thank you all for coming.
Thank you again. Have a good day.
Okay? All right, at this time, we have the dental examiners. Good morning. Fine, fine. Everything going good? Yeah, yeah.
Good to see you. All right, hey Denise, how are you? I'm ready. Yes, I'm just gonna do the prelim, and then you take the salary stuff.
Oh, let me ask you a question.
Yeah, I know it has. I know it has. Oh, absolutely. Do we need two over there?
Did William get one?
I gave William one, yeah.
Okay, and then you get one to the senators.
All senators are good. I didn't know if she needed one or. Okay, well, there's our extras regardless.
Did Brett get one?
Okay, at this particular time, we have our
I didn't see Brett.
Board of Dental Examiners.
Yes, sir.
Okay, and we are ready for you to tell us what you're going to tell us and then tell us how you propose to resolve some of these issues.
Yes, sir. That's what I came here for. Hey, I'm Chris Hutchinson. I'm the Executive Director with the State Dental Board. As you're aware, we are legislatively mandated to regulate the practice of dentistry in the state. We regulate roughly about 2,000 dentists, about 2,100 dental hygienists, a little under 4,000 dental assistants. We also regulate the permitting side of this practice, which is 12 specialties for dentists, to include periodontists, endodontists, oral surgeons. We also handle the anesthesia side of dentistry, which is there's 3 different classes which we've implemented through the OLRC over the last year. Just to let you know, over the past 2 budget cycles, and this was some of the good news that y'all have allowed us to do over the last 2 cycles, was number 1, that we implemented a new licensing and a compliance system. Y'all were able to budget that for us over the last couple of years. We rolled it into, we had some issues where a company was fired, but I'm happy to report that last Monday we went live with our new licensing system and our new database. We're already seeing huge strides with that. It's going to save a lot of time. It's going to save money for licensees to be able to get on and actually pay. We've worked real hard since my time coming completely where we don't touch money at all, not checks, not anything. And this new licensing system is going to allow that. Another big goal that we did was, if you'll recall, was I pushed hard to get in-house legal counsel. I have, for the past 3 years, used a third party where roughly it would cost my budget about $150,000, give or take money here or there, depending on what we worked on that year. Now I'm able to use in-house counsel for $75,000 a year. So I was able to save on that bottom line of that budget and our spending authority in that manner. Now, we're come June of this year, we will say a final goodbye to that third party. That third party, again, I only used 33% of his time because he was also the third party for a couple of other agencies. Now I have in-house counsel, which my intention was to bring him over here and let y'all meet him because he started back in October. He's doing a fantastic job. So that's a couple of things that we've been able to do. As far as this year, Mr. Rossett is going to cover the budget request when it comes to our what the Personnel Board is recommending for our agency, and so I'm going to let her take it from here.
Okay. Before we let her take it, one of the things I would like to say that your theory proved to be right from last year, and talking about having a person in-house to do the work. We're pleased with that.
Thank you.
Your question,
Thank you,
You wanna take it?
Mr. Chairman. We appreciate y'all being here today. I guess I've been involved with y'all since I've been down here, and, you know, and you talked about how getting an attorney would be a benefit. Is that one of the reasons your contractual is going down?
Yes, sir.
Okay.
Absolutely.
So you say you're spending about $150,000 a year on the contract attorney. Now you have full-time, that's working out for you?
Yes, sir, absolutely. I was able to hire an attorney from the nursing board, so he already had experience in the regulatory field. It's just learning a different code statute, learning some different regulations, and he already actually tried one of our disciplines last Friday, as a matter of fact. It was his first one that he was able to participate in and take full control of, while the third party, who, like I said, he's still here through June to help train and move forward. It was pleasing to me to see the third party sit over there silently and let our new counsel handle it. And
And I think that was one of our concerns originally was, since you've had, I think you'd been there a long time, your contractual attorney, having somebody that could actually come in and, I guess, learn the process, because it seems like it's a real specialty type of law.
It is, yes, sir. It's a little different because, you know, you don't have necessarily the same facts for looking at evidence. You know, there's a lot of peculiarities and some specialties that a regulatory attorney can handle. And again, Mr. Ingram had been there for 22 some odd years.
Right.
So you know, we're losing a lot of experience, but he has been so easy to deal with. He's ready to retire. You know, it was time.
All
So.
right. Well, we appreciate what you're doing. Like I said, you know, it kind of pays off, or it looks good for us too, whenever you can see some of these numbers going down, and I think it's a better setup for you, so.
Yes, sir.
Thanks,
Thank you.
I want to talk just a minute about the salaries. You're going to hear about salaries a lot this session. One of the things that again, we didn't know is what the State Personnel Board was going to do. I want to tell you first that the Dental Board worked really hard in the last couple of years to reorganize their staff. They did a complete analysis of their operations, and they changed their job descriptions about 3 years ago. And so when the new SPB classification systems came in, we didn't have any issues. They were classified where they needed to be. The only thing was their salaries were not at the levels of the State Personnel Board. We actually have 2 employees that are below the minimum for their job, and so we are asking that that they get that salary changed, but we're not asking for them to be at the complete minimum. One of the things about this is because they do work in a health-related field, the minimum for the deputy director is actually $82,000, and that is more than the current executive director is making. So we are not coming to you saying, please give us the full salary for that position. It would raise her up more than is a good span of increase. So we're really only asking to bring her to $60,000. She's currently at, actually I don't have her current, yes, 52. So we're only asking to bring her up to 60, but again, the minimum on that position is $82,000. So our budget request is just to bring her to the 60. The second one that we're asking for, the investigative staff, again, the State Personnel Board is trying to have a level playing field so that you don't have employees jumping from one state agency to another because they're now all investigators. But we realize that the investigative slot for the lower investigator, the newer investigator, again, doesn't need to be as high as is requested. The minimum is for $43,000, but we're only asking for $40,000, and that's because we want to keep equity inside of the agency. The licensing agents are making the $40,000, so we're just asking for the investigator that's pretty much doing the in-house investigations to be at the same level as the licensing. So again, we're not asking for the full salary. And then for the executive director, the State Personnel Board said that the executive director in other contiguous states salary would be at $114,000. We are not asking for that for the executive director. Their board would like to take him to $85,000. That would give, right now he's making less than that attorney that we've just talked about. So we need him higher than the attorney because that's who he's supervising. But again, they don't want to go up to that 114. So they're just asking, the board wants to have $85,000 as his salary. And so that is the only request that we are making, is just to get these positions corrected. And then you'll notice that even with these changes, it's less than what the legislative budget recommendation is for this agency.
Okay.
That's it.
And the request over last year's budget,
The total request, we're reducing it by $25,000 of what the LBR is. So we're asking for right at $1,051,051, and last year we were at $1,123,000, and so we're 25,000 less than the budget request, or recommendation.
okay? Are there any questions? Okay.
Thank you, Mr. Chairman. Y'all mentioned this new licensing system. Will your budget be able to decrease after this is finally implemented?
It actually, we've already put that factored into FY23's request. We've already reduced the contractual for that. We did have to add that, we didn't have the implementation cost in '23. We do have hosting cost. So we did add a little bit for that and a little bit for maintenance, but the actual implementation cost has already been decreased from our budget.
And do you have those figures, how much it changed?
I knew you were going to ask me. I've got it in front of me, but and the reason I'm hesitating is, as the executive director mentioned, we went out for a bid process 2 years ago, and that whole system failed. And so we had to go out again, and I think the new system was $150,000 for the whole system. And then I think the hosting fees are $36,000 a year for hosting and maintenance. But I can give you that for sure if you give me a second to look at my paper.
So that 150, y'all wouldn't need that next year?
Right, and we've already reduced it out of the budget request.
Okay, all right, thank you.
I want to make that clear. We've already taken it out, so don't take it again.
So that's the end of the 25. Under it.
Our IT cost, if y'all want it, I have it. I have those numbers if you want them. Okay, for our technology cost last year, we were in '21, we were at $164,000. This current year, we are budgeted at $150,000, and for next year, our request is only for $86,700.
All right, thank you very much for those numbers.
Okay, are there any other questions? No questions? If not, we will definitely take this on there, and get back with you. Okay?
Right. Thank y'all very much.
You have a good day.
And I just want to say, we want to thank William for all his hard work, too.
Okay. Nice seeing you, sir. You keep doing what you're doing.
Good luck to you. Good seeing you.
Keep doing what you're doing. Yes, sir, I will. Okay. Okay, now we have.
Additional questions?
No, I think I understand that now.
Okay.
We have the pharmacy board
I believe that's.
over here. Okay, next we have our Board of Pharmacy. this last one. Good morning, how you doing? Fine. Good morning. Okay, at this time we have our Mississippi Board of Pharmacy that's coming before us now. And what we'll do, we'll allow the introductions first, and then we'll go from there.
Okay, good morning. We appreciate y'all giving us the opportunity to come and talk to you a little bit about our budget bill. So I'm Susan McCoy. I'm the Executive Director with Board of Pharmacy, and this is Todd Deere. He's our Associate Director. So anyway, so.
Say your name again, please.
Susan McCoy.
Okay, Ms. McCoy.
Okay.
And Todd Deere.
Okay.
We ready to go?
Very good.
Okay. Okay. As a health-related agency, the Board of Pharmacy, we operate in an ever-changing environment. The board is greatly impacted by industry changes, development of new pharmaceuticals, guidelines from the FDA, lots of other federal rules and regulations that get written, USP standards, and also initiatives from all of you. Due to the numerous external factors which have an impact on the board and our operations, it is imperative for the board to be flexible and have the budgetary authority to address the issues as they arise. The organization of our office and its operations have been designed to meet the needs of those we license while protecting the general public. Within our office, we have four departments. We have our licensing department, our compliance department, our prescription monitoring department, and our pharmacy benefit managers department. Our licensing division oversees the registration, licensure, and regulation of pharmacists, pharmacy technicians, and students, people, and other drug facilities across the nation. This division also permits facilities that maintain, distribute, and dispense legend drugs and controlled substances. Our compliance division inspects facilities, investigates licensees, and responds to complaints when they're filed with our office. The activities of the compliance division often results in board hearings, and when necessary, disciplinary actions as prescribed by our current pharmacy practice regulations. Our prescription monitoring program maintains a database which monitors the dispensing of Schedule 2 through 5 controlled substances, plus any other additional drugs specified by the state. The number one objective of this program is to reduce prescription drug abuse by providing a controlled substance dispensing patient record to the practitioners who administer, prescribe, or dispense controlled substances. This system is utilized by pharmacists, dentists, doctors, nurse practitioners, and law enforcement officials when necessary. The Pharmacy Benefit Manager program licenses PBMs and helps ensure appropriate patient access and services that are provided as authorized by our law. Since our original budget was submitted, we've had a couple of things that have come up. We've got two new items that are having an impact on the agency operations. The first one is our PBM legislation that y'all added last session, which has had a large impact on our agency. There's been a rise in the need for legal representation to handle PBM-related matters. It was originally believed that we could handle this contractually, but as that time has gone on, we have had trouble locating a contractual attorney to represent this because there's so many conflicts already that have already been established with external law firms. As we've tried to get somebody in multiple times, we'll get them understanding a little bit about what a PBM does, and then before it's over with, they can't get their conflict waived. And so we've had to start over multiple times to try to find an attorney. Currently, we've got our regular legal representation is just a part-time position. It's contractual, and so he's already handling all of our regular board business, so he does not have the time to do the PBM legislation regulations that we need. And so that's our reason for asking that. The potential for disciplinary actions concerning these complex issues may result in civil action, and so that's also a real possibility. We're having to consider those things that could happen, you know, as we go on with putting the board in a bad position and needing some more legal representation. These issues have definitely changed our staffing needs of the agency with the legal representation. We're seeking to have a full-time attorney position established to oversee all the tasks associated with representing the board. Having this position will enhance the board's ability to react to issues as they arise, will allow research on complex cases to be conducted in a proactive manner, and will allow the investigative staff to have access to legal advice during the course of their work instead of just being provided a review of the cases in preparation for the hearings. The salary for the attorney, we think, should be set at $114,444, which is the market rate for a high-level attorney position. And then the total cost of that position with the fringe benefits is $150,150.02. The second item that's developed since the board submitted its original budget relates to the collaborative effort between our agency and the Mississippi Bureau of Narcotics. Bureau of Narcotics approached us probably in September or October and asked us to join with them in a venture to try to curtail some of the problems that are arising with the pill presses and the encapsulators. They've recognized a need to investigate these entities with the pill presses and the other counterfeiting devices that are going along with that. MBN has requested that the investigator be a pharmacist with the knowledge of the pharmaceutical industry and with supervision by our board, since it's a pharmacist. And then to meet this request, the Board of Pharmacy is seeking to add a new investigator to our staff. And the salary for that position is $137,267. And since the cars are provided for our investigative staff, we're asking for a car to be provided along with some of the other commodities with fuel and vehicle maintenance and supplies for that employee. That cost is to be added to our appropriation bill, and MBN is seeking the same amount as Special Fund Appropriation Authority and is seeking the ability to transfer those funds to our agency within its own appropriation. This transfer would function in the same manner as our funds received currently for the PMP program from the Board of Medical Licensure, the Board of Nursing, and the dental examiners. It's almost like a pass-through that's going there. The only additional item needed for this to be implemented would be to modify Section 8 of our appropriation as follows, and it's written there as our code, and all it does is add the term investigations and. It allows us to, the Mississippi Board of Pharmacy may accept and expend funds from any other state agency to defray the expense of investigations and the prescription monitoring program. The agency wishes to thank this committee and our budget analysis for their consideration of the board, its operations, and its FY23 budget request. The budget recommendation aligns with what we requested in every category except for the salaries and the replacement of the vehicle. Our salaries last year when we did the 3% was voted by the legislative increase by House Bill 109. It was appropriated within that, but it was not within the agency's actual FY22 appropriation. It was later discovered that due to a system glitch, the calculation of the 6-month salary amount needed for the FY22 3% raise was incorrect within House Bill 109. The appropriation was only $4,827 instead of the $24,520 that was needed. The LBR salary amount was based on this miscalculation. And we're still, I think as late as yesterday, got some more information about some salary changes. So that could still, we'll get that information back to you as soon as possible, as soon as we get with our budget analyst. Denise caught me outside and told me that there was a few other little changes yesterday, I think, that we'll make sure that we get back to you as soon as we can get all that adjusted. The only other request was the vehicle. The LBR had cut one of our vehicles in their recommendation, but our vehicles, we don't replace them until they have 150,000 miles on them. And so, if we don't need it, we won't use it. It's just there, to have it in case one of our agents need it while they're out in the field. So we're seeking to restore that second vehicle there for our normal use, and then we'll add the third vehicle with the MBN request. As you can see on the handout that we handed you, our numbers are all there so that you can look at them. Our total budget request is $3,715,609. Like I said, that could change just a little bit depending on what our salary numbers end up being. But our board received its revenue from licensure of pharmacists, pharmacy technicians, pharmacy benefit managers, and the issuance of permits to numerous types of facilities. The fees collected each year and the cash balance are more than sufficient to fund the total request. I've got our cash balance down there. It's right at the end of December. It was right at 5.7 million. And then just another note that's a little bit interesting is because we don't take general fund money, but we do contribute to the general fund. Last year, our fines went up. It was $175,000, a little over $175,000 that actually got contributed to the general fund that did not come to us off of the fines. And of course, we did not receive any of that general fund money. So that's just kind of a little oddity there that I'm not sure everybody has that. But anyway, that's where we are. If y'all have any questions for me?
At this time, are there any questions? No questions. I did understand you say one thing about the vehicle, and you're keeping it, instead of taking that vehicle offline, you're keeping it there to utilize.
No, sir. As soon as it hits 150, we sell that vehicle and get a new one. So that one goes back into the stock, the surplus stock. And we sell it at, usually we go to go to the auction, and they sell it there,
Okay,
and then
I'll
that money
miss it.
comes back.
Okay?
We've got to have good working vehicles for our agents to be out in the field because they're traveling the state every day. And so we try to, not push them up too far above 150 before we can. But now, this past year, I think we had one that did go over 150 just because we couldn't get a vehicle. So.
Okay. If there are no questions, then we definitely will take this under advisement and let you know, okay? We would definitely take this under advisement and get back with you.
Okay. Yes, sir. Thank you. I've got cards if anybody needs them, but I think y'all know how. You got one? Do you need one? Or yeah, y'all, please feel free to call me.
Thank you very much. Okay, can we get a motion? All right.
I was going to introduce myself. Corbin Stanford.
Okay, it's nice to meet you.
So I work for Senator Hobson,
Let me look over these.
writing the appropriations.